Thank you.
Thank you so much to be here.
Thank you for having me. It's a wonderful group. I'm honored to be here. Yeah. So, how do I get this on? There we go. The Time Waiver staff helped me to establish my, my topic for today. Because you think in fundamentals, what is the human spirit, what is the human body? The theme of today's lecture was obvious, treating behind the obvious. So to just review from yesterday, the specific frequencies were developed in the early 1900s and used by thousands of practitioners until about 1934. Harry van Gelder was an osteopath and naturopath born in Australia. He was Dutch, trained in England after the war, came to Canada actually, bought a practice in 1946 that came with a machine that was built in 1922. George Douglas went and worked with Harry van Gelder, and this machine came with a list of frequencies. Harry learned to use them and became quite well known over the Western United States and all across Canada. And George brought the frequencies home from the list, from the machine, put them in a drawer, and in 1983, I think, and then found them again in 1995. So we started using them in 95, 96. I started teaching them in 97 to find out if they were reproducible. I have no idea how the frequencies were derived, and I honestly don't care. The important thing to me is whether or not they work and have a predictable effect, and whether or not they are teachable and reproducible. So we do know that the 1920s equipment is not microcurrent. So the frequencies are very specific, and I did not give this list yesterday, I don't think, but the frequency for inflammation reduces inflammation, and that's all it does. It doesn't change range of motion. It doesn't do anything except reduce redness and swelling and pain and inflammation. That frequency does only that. There's a frequency for fibrosis and scarring that increases range of motion, but does nothing for inflammation, does nothing for pain unless the pain is being caused by the scarring. There's a frequency that stops bleeding. It just stops it, prevents bruising and new injuries. So it's why Terrell Owens' foot did not get bruised or swollen, because we use the frequency to stop bleeding. Toxicity changes function, changes pain sometimes, but somehow doesn't cause detox reactions, and that's what we're going to talk about. There's a frequency for shingles and oral and genital herpes. That virus reduces pain, eliminates the lesions within 24 to 48 hours, takes 2 hours treatment, but it does nothing else. It is not useful for any other kind of pain except for shingles. And there is one frequency combination. The only thing it is good for is kidney stone pain, the pain that comes when you pass a kidney stone. It doesn't do anything for the stone. That's a separate protocol. It does only the pain from the kidney stone. So yesterday we talked about the fact that microcurrent increases ATP production by 500% and provides more or less unlimited energy for healing. As long as you're between 10 and 500 microamps, the ATP is going up by 500%. Between 500 and 1,000 microamps, the ATP levels off, and above 1,000 microamps, the ATP actually drops. So when you use the higher amperage devices and electrical therapies, you're actually they do what they do, but they decrease ATP production according to the studies. Nak Cheng in 1982, and then Seegers in 2001 and 2002. So the increased ATP allowed the cell to make more protein synthesis, increased by 70%, and amino acid transport by 40%. So There's a case I want to get to, but there's some introduction that makes that case make sense. So frequency-specific therapy treats muscle pain and scar tissue. Scar tissue is easy, by and large, muscle pain is easy. When we treat myofascial pain or muscle and fascial pain, first we treat the nerve, then we treat the disc and the facet joints, and then we treat the muscle. For the best results, you always seem to treat what's causing the muscle pain. So we know for sure that we can treat the nerve. We have one paper published on that. It was only 20 cases, but the statistics are very nice. The 20 cases, but they were 7 years chronic. So all of them had seen at least 3 to 5 other practitioners before they got to me. All patients experienced pain relief. When they came in the first visit, their pain level was about a 7, and at the end of the first visit, as an average, it was down to a 1 or a 2. And that p-value has 2 zeros, so 0.001. Those of you that know statistics know that's a very nice number. With an N of only 20, it's lovely. On the second treatment, their pain only went back up to a 5, roughly, on a 0 to 10 scale. And at the end of that session, it was a 1.9 out of 10. 65% of them, 13 out of the 20, experienced complete relief and recovered from the nerve pain with 4 or 5 sessions, twice a week the first week, twice a week the second week, and then 1 treatment in the 3rd week to make sure they're still okay. So it's roughly 5 visits. Aside from getting pretty euphoric, there are no side effects, but 25% terminated care prior to recovery. There were 5 of them. Once again, if you've been in pain for, what is that, an average of 7 years, and someone gets you out of pain at the end of an hour, who are you? Right? So this is something you have to deal with if you do pain therapy with FSM. And we know we can treat muscle pain. That's where I started out. First paper we published was cervical myofascial pain. There were 50 cases, 5 years chronicity. The range was 1 to 28 years. And 88% of those patients had failed with other treatments. So we figured that if they were going to have a placebo effect, they would have had that placebo effect with one of the 6 other people they've seen before they got to the clinic. So they were effectively their own controls. 11 treatments in 8 weeks, their pain went from an average of a 7 to an average of a 1.5 or 2 out of 10. And the reason it took that long and that many treatments is I didn't know what I was doing. Back in 1997 and 98, I thought it was muscle because I was a muscle therapist, so everything is muscle. And so I treated the muscle. And what we found after a year was in the cervical spine especially, it's almost never the muscle. It's the disc, it's the facet joint, it's lax ligaments, and the muscle tightens to protect those joints, those structures, and then you feel the pain in the muscles, but you have to guess at what's causing it. So the lumbar cases were, I got lucky. There were 23 cases that were published in 2004, more chronic, 8 years, 87% had failed with other treatments, and these were more representative of what we do in actual simple low back muscle pain. 6 visits in 6 weeks from an average of about 7 down to about a 1.5. There was a lady yesterday who came in and she had terrible shoulder pain. My shoulder hurts a lot. And it was in between her shoulder blades. And we ran only 3 frequencies to treat the nerve, to allow her to move her arm better, and to relax the muscle that created the pain in between her shoulder blades. Then we treated scarring in the nerve to let her move her shoulder more normally, and then we treated the disc. And I think it was 20 minutes, and she was out of pain with full range of motion. And I told her it wasn't going to last because the shoulder pain is coming from her neck. So it's behind the obvious. What you see is here, But the frequency response helps teach you where it comes from, because that's the only treatment that works. We know we can dissolve scar tissue because we did it. There are frequencies that dissolve scar tissue, and that's all they're good for. We did a study in 2003 with 8 burn patients. They were chronic burns, scars from grafts and failed grafts. It is known to be the most difficult kind of scar tissue. All patients, while 7 of the 8, had statistically significant increases in range of motion that were permanent. It was an extraordinary experience. If you're ever feeling sad or that your life is difficult, just go sit in a burn unit for one morning. It puts everything into perspective. So all of them, for one man, his goal was to be able to hold a coffee cup. He burned himself making fried eggplant for his family, right? And the oil spattered and caught fire and hit his hand, his arm, and his chest. He was an opera singer. And his goal was to be able to hold a coffee cup. And at the end of 3 days treatment, 3 one-hour treatments, he could hold a coffee cup. Then we did abdominal scarring. Is a very difficult condition in patients with endometriosis and Crohn's disease that get adhesions in the abdomen. And there's a researcher in Texas that does surgery on a rat and then causes an abrasion in between the cecum and and on the abdominal wall. Then he puts them together when they're raw, puts a stitch in it, and closes the rat up and waits a week. And at the end of that week, you have a fully mature scar tissue that is almost like cartilage. It was white, it was tough, it was like gristle on a chicken or a steak. It was very hard. So we opened up the rats in the second week. We got permission, the rats are anesthetized, and we took the microcurrent and put it on wet gauze on the outside of the rat's abdomen and ran current through the abdomen. He snipped the stitch, so now all that's holding this together is the scar tissue. But it's dense and it's tough, and if you were a surgeon, you'd have to cut it with scissors. Those of you that have done surgery know what kind of adhesions I'm talking about. So, so there were 6 frequencies I thought I would try. I tried the first 3, nothing happened. I tried the 4th one, nothing happened. I got to the 5th one. 13 hertz is the frequency to reduce scarring, and 77 hertz is the frequency for connective tissue. And I didn't expect it to do anything. I was ready to just move on when it failed. And this white cartilaginous adhesion became clear, like coconut oil when it melts. So it turned from white and hard to clear and then liquid. It was like snot. It just was liquid. We did it the first time, and then we did the second rat and put things in different order. But as soon as I got to 13 hertz on channel A and 77 hertz on channel B, it turned liquid. So then the next day we treated 8 patients who had an average of 10, 12 years chronic abdominal pain, and it worked on the patients. You use 13 and 77 to dissolve the adhesion itself, and then you still have to treat the scarring in the abdomen that holds the different organs together. There's a case report at the very end that I don't know we'll have time to get to, where we talk about being able to dissolve, how it changes a patient's function when you can dissolve not only the adhesions between the organs, but the adhesions between the vagus nerve and the organs. It was transformational for this woman's health. And it started with this experiment. Now, with power comes responsibility and restrictions. So the scar tissue frequency cannot be used in the first 5.5 to 6 weeks after an injury. So when I treated Carolyn, it was 5.5 weeks before I would run. We were at the Super Bowl before I would run the frequency to dissolve scarring, because the time was so short. If I used it too early and I took out too much scarring, he would never have made it. We didn't have time to put the tissue back. So the rule about frequencies to reduce scarring is you can't use those frequencies within 6 weeks of a new injury any place on the body. And we know that manual therapy combined with FSM is a powerful tool. It's as if the frequencies vibrate the bonds holding the scar tissue together. It gets them to loosen, and then when you mobilize them, when you put your hand in it, those of you that are manual therapists that do body work, it melts them, and it changes the treatment time parameters. What used to take you 6 months of regular therapy is done in 3-4 weeks. It is it totally changes expectations and outcomes, especially for athletes. So we knew all that. But what do you do when that doesn't work? So this case report seemed appropriate. The patient said, "My vagina is scarred from a tear when I delivered my second child. And there was an episiotomy. They stitched up her vagina at the rectum, and it's so painful that I haven't been able to have intercourse for 18 months since my son was born. Can you help me?" She was a student in a class. So at the end of the day, with her husband there, he was also a student, I said, "Sure, we will treat." So you put one contact behind the sacrum. I wear a graphite conductive glove, a graphite glove that conducts electricity, and then I put a vinyl glove over it with water and some lubricant, and you can insert your fingers in the vagina. It's part of my training. And so I inserted my fingers, and there was no vaginal scar tissue. She didn't have an episiotomy scar. I've treated those before, lots of them. Wasn't there. But she had so much pain she couldn't have intercourse, and they wanted to have a third child. So I inserted my fingers another centimeter, 2 centimeters, and touched her pelvic floor muscles, and she just levitated. They were in spasm, like rigid and extremely painful to touch. I treated the nerve, I treated the muscle, I treated scar tissue. It did absolutely nothing. 3%, 5% change on the left, and then I switched to the right. 2% change, went back to the left, and it was bad as it was when it started. But while I'm treating, the patient is talking all the time. She's talking while she's being treated. And she said, "My first child was born early and was in intensive care. And so what do you do when your child is in the hospital, your infant is in the hospital and in intensive care? You go home, you have sex with your husband." So her second child was born 10 months after the first child. They were right 10 months apart. And then she said, "My uterus never had time to recover." And you listen as the patient talks. And then she told the story again. You know how some people will just repeat the story? She told the story again. And she said again, "My uterus never had time to recover." And then she told pieces of the story again in a different order. And then she said again, "My uterus never had time to recover." So by then, the message was sort of obvious. And since nothing else was working, it was like, well, what is it? The muscles are in spasm. Why are they in spasm? Your cerebellum controls muscle tone. Absolutely. You do not get to vote. You are not sent a message about why it's doing it. But your cerebellum, brain, controls muscle tone. Why were they in spasm? The cerebellum regulates muscle tone. So what was the cerebellum trying to protect? Look at the architecture. What is the cerebellum trying to protect? By contracting these muscles, there's the uterus, there's your sacrum, there's the pelvis, there's the uterus. There's the muscles, there's the uterus. What is the cerebellum trying to protect by tightening the pelvic floor muscles and preventing intercourse? My uterus never had time to recover. Ask yourself, recover from what? I use the frequency, the first thing you'd think of, right, is the emotional trauma. So I used the frequency for the emotional trauma. Did nothing, like nothing. Recover from trauma to the uterus, there's a sequence that you just use as a rubric, as a rule. You do emotional, you remove trauma, you sort of reboot the tissue and then treat allergy reactions. So as part of just following the alphabet, following the rule, the frequency to remove trauma from the uterus completely relaxed all of the pelvic floor muscles in 20 minutes. That one frequency ran 20 minutes, and all of the pain was gone. I ran through the other ones just to be complete, but let's see, 11 months later, her second child was born. So this frequency combination, and only this frequency combination, the frequency to remove trauma is 294 hertz. On A, the frequency for the uterus is 34 hertz. On B, intercourse was pain-free, and her third child is now 2 years old. But you have to pay attention. So how did that happen? This is a continuation of the conversation we had yesterday. Trauma is a pattern stored in the tissue. If you are a semiconductor and you push save, and the pattern is saved in your fascia and connective tissue, in your information field, if you will, but it's physical, right? The body responds to the pattern, remove the pattern, and the tissue changes. This is not always predictable, but when nothing else works, it makes sense. It takes us back to biologic resonance. Drugs and nutrients are like keys. They act like a key in a lock to change how the cell functions. The frequencies are like a key-fob opening the same lock with a signal, and they change cell function, cell signaling, and ultimately cell structure electromagnetically. It's very direct, it's very teachable, it's very reproducible. Basically, change the pattern, treat the cause. They asked me to talk about detoxification. And heavy metal detoxification is more complicated. Organic chemicals and general toxins are more straightforward because they're not charged. So you have to ask yourself, we use that word, we're going to detoxify. Do you ever stop and think what that actually means? We have this idea that we're sort of swimming in this soup of toxins. Toxins take many forms. Right now we're just going to talk about the 3 frequencies that we have for general toxins and organic toxins. But what are you actually doing when you detoxify the patient? In natural medicine, we support the liver, you support the kidneys, you get the colon moving so you can excrete toxins. But that doesn't always work, right? And it takes a long time. Why would it take a long time? Have you ever thought about why that's so difficult? Organic chemicals, fragrances, any organic chemical is uncharged, it's fat soluble, it's absorbed through the lungs, the skin, and the intestines. And you take in a food that has been treated with pesticides, and that organic chemical comes in and is absorbed through your intestines. You go down the detergent aisle in the grocery store, and that smell that you have, the fragrances from the soap, that's absorbed through your sinuses and your lungs, Okay? So they're absorbed. How do they alter patient health? They become embedded in the cell membranes and they change cell signaling. This is what your cell looks like. There are proteins that go through the cell, and you are exposed to, let's say, our favorite in the US is Roundup. It's everywhere. I think it's illegal here, thank God. But anyway, so you have an organic chemical that gets embedded in this lipid membrane, right? And it is heavy, and it has the ability to change cell signaling. Benzene, ethanol, different, right? They change how the signaling molecules work. That those signaling molecules affect genetic expression and cell function. So the organic chemicals that are embedded in the membrane on themselves, that's not a problem. If it was just sitting there, it wouldn't do anything. The problem is that they change, they're heavy, and they affect this receptor. This receptor is sitting in this membrane, and they're heavy, and they're active chemically, and they are like a signal that changes this receptor. But when you think about it, your cell membranes turn over on a regular basis. And when that cell membrane is recreated, that organic chemical leaves. It's not there anymore. Did you think about that? The cell membrane changes. It turns over, and the chemical itself is detoxified and has been excreted. That's what you're doing when you get them to support the liver and the kidney and the colon. You're helping them excrete the actual chemical. Well, the toxins are gone, but the signaling is still altered. That's why it takes so long for the patient to get better. You've gotten rid of the toxins. You did that. You do your job. But the signaling, this receptor is still modified because of that. You've gotten rid of the chemical, and the receptor is still altered in a function like an antenna that got pointed the wrong way and now just needs a signal from Earth to turn it back. Does that make sense? Yeah? So we have 3 frequencies, 57, 900, and 920, that change cell signaling after the toxins are gone. We use the frequencies to remove toxicity, and the thing that took me 15 years to understand is why patients don't get detoxification reactions. We run 57, 900, 920 on the liver, the brain, the lung, the pancreas, the gut, wherever tissue and function has been affected by toxins. We run these frequencies, and in 20 years, I've never made anybody sick. If we were removing toxins, they should get sick, right? The results of the treatment educate you, teach you. If we were removing toxins, it would have made them sick, and they didn't get sick. Finally, after 20 years, when we come up with the cell signaling model, it's like, oh, the frequencies we think are changing the pattern or the effects of the toxicity instead of removing the toxins. So when we treat and detoxify patients, if you do both together, it takes what is a 2-year project or a 1-year project into 4 weeks, 6 weeks. My job is to make your job easier. Brain, the gut, liver, nerves, fascia, kidney, lung, wherever the toxins are embedded, we change the signaling and the tissue function changes. Heavy metals are different, and we teach those in the advanced because in heavy metals, because they're charged, they're actually bonded into the cell and they don't leave when the cell turns over. And you can make somebody sick with the frequencies for the heavy metals. So I'm not going to give you those frequencies at this level, and you'll notice that the heavy metal frequencies are not in any of the books. I made somebody pretty sick once, and it taught me a lot. So you use the heavy metal detox in combination, detox frequencies in combination with the other things you do to actually chelate and remove the metals. It's not something to do casually. So there's lots of things we can do. It's equally important to say what we can't do, all right? I can't fix everything and everybody. It's not a panacea. It's physics. It's biophysics, but it's very difficult to fix something that keeps getting broken. The most important thing, if you're going to bail out a boat, is to stop shooting holes in the bottom of it. So changing the patient's diet and posture and sleeping and emotional attitude is important, because the frequencies are a tool that helps you do what you want to do. And you can't treat what you don't think about. The people I treated those first 2 years where I didn't think about the discs and the ligaments and the facets, it took me 12 weeks. Once I figured out what I needed to treat, it went back to taking 4 to 6 weeks. It will treat exactly and only what you choose. So, if you think all problems are emotional, and in this patient, they're not emotional, it's not going to work. If you only treat emotions, and it's not emotional, it's not going to work. And if the problem is not toxicity, and you only treat toxicity, it's not going to work. If the problem is not the muscle, and you only treat the muscle, it's not going to work. And in point of fact, the frequencies always do exactly what they're alleged to do. So when I was treating the woman's pelvic floor muscles, and I treated the nerve and I treated the muscle, and it didn't change, it wasn't the muscle. Then the task is to make your brain work and say, okay, then what is it? Are there people here that do physical medicine that treat sports injuries? Okay, 1 or 2. Well, this may not make much sense then. The frequency response makes you think. It is a gift for your mind. So this is more for physical medicine, which some of you may not get, but it tells us how to think about what the frequencies are useful for. So the cerebellum will inhibit any muscle that puts at risk a nerve. The cerebellum is nerve tissue. Its job is to protect its fellows, the other nerves. So we had a marathon runner in Australia who's brought to the course by her doctor and her coach. And she ran marathons for a living. This is what she did commercially for a living. She ran marathons and ultramarathons. And they came and they said, her right glute is weak. So her gluteus, which extends her hip, is weak. And so she keeps injuring her hamstrings. So they are a weak extensor. The glute is weak, so the hamstring gets injured. So the first question is, even those of you that don't do physical medicine, does it make any sense to you that somebody that makes their living running marathons would all of a sudden in 18 months have a weak major muscle that regulates running? Does that make any sense? No, right? Okay, so I knew it wasn't the glute. Now they'd been working on the glute for 18 months. Didn't work. And that means it's probably not the glute. So I rolled her over on her back, and they said, no, the problem's in the back. I said, honey, you've been working on her back for a year. If that's where the problem was, you would have fixed it. So test it in here and asked her when she had her groin injury, because that was not part of her history. Her groin injury was 20 months previously. She had a little groin pull. Her femoral nerve was glued between the quadriceps and the adductors, and very painful. So we treated for inflammation in the nerve, scarring in the nerve, dissolved the scar tissue in about 20 minutes, rolled her back over on her stomach, and they tested the glute, and it was now 100% strong. The glute was inhibited to protect the nerve here. The lady yesterday with the shoulder pain, almost everybody, right, has tender muscle spot in your armpit. Have you ever had your shoulders worked on? Right, it brings tears to your eyes. Okay, so there's a nerve under there called the subscapularis nerve. And the subscapularis muscle does this and this. It internally rotates and adducts. The subscapular nerve gets irritated from the C5-6 disc. The nerve gets inflamed, and so it gets adhered to a muscle that does this. The cerebellum is going to turn off the muscles that do this. It will turn off external rotators and adductors to protect this nerve. If you want to fix a shoulder with a partial thickness rotator cuff tear or impingement, you have to relieve the scar tissue between the nerve and the fascia, okay? So you look for what is behind what you see. You see shoulder pain, you see impingement, you see gluteal weakness, but why is it there? This principle applies to everything. So the course, the 4-day seminar, the books that you bought, it's just the beginning. The frequency response will teach you what you need to know. Because unless you had a way to dissolve adhesions between the nerve and the fascia, how would you ever know that these adhesions were what was causing the inhibition? Unless you have a way of treating it, you don't think about it. Nerve pain is the easiest thing we treat. So medical physicians and physiatrists and chiropractors don't think about nerve pain because they don't have a way to treat it. For us, because treating nerve is so easy, it's the first thing we treat. Unless you had a way to remove the fact of trauma from the uterus, how would you ever think that it caused pelvic muscle spasm? She might have done it accidentally over the years through hypnosis or regression, but to be able to do it in 20 minutes by removing the pattern, you would never think to do that unless you had a tool that let you. So the frequency response makes you thoughtful. Frequencies change autonomic function directly, immediately, without drugs, without meditation, and without extensive therapy. So the frequencies change autonomic function. This study was done by Roger Billica. Besides the interesting data, the most important fact about this is I didn't do it. What the frequencies do is teachable, reproducible, and predictable. Roger is a medical physician in Colorado. He did a test after lunch. Here's the sympathetic nervous system. There's the parasympathetic. After lunch, you would expect the parasympathetic to be more active, and it was. He did a 1-minute treatment to increase the activity of the sympathetic nervous system. 1 minute. Then he had a 2-minute wait, so he wasn't testing the effect of the frequency while it was running. And then he did a retest. And the sympathetics came up, and naturally that drove the parasympathetics down. He did another test. He did a 1-minute treatment, a 2-minute wait, and a retest. And for here, he did the frequencies to quiet the parasympathetics, to take them down, drove them into the ground. For here, 1 minute for each frequency, a 2-minute wait, and then a retest. And he was able to increase the parasympathetics and quiet the sympathetics. So he ran 3 frequencies. So it was actually a 3-minute treatment, a 2-minute wait, and a retest, right? And he brought it back to normal. Once you're able to do that, it teaches you a fair amount of respect. Just because you can, should you? So he found it useful in patients where you needed to quiet the sympathetics in order to improve digestion and mental state and sleep. It's easy to quiet the sympathetics. It's easy to improve digestion by running the frequencies to improve the parasympathetics, right? However, to achieve lasting effects, you have to change the stable state. The frequencies work to create instantaneous changes. They're in minutes, right? So the best example is of a change in state is water. Water is completely stable as ice as long as the temperature is 0 degrees centigrade. When you add heat to the system and you get to 1 degree centigrade, and in between 1 degree centigrade and 99 degrees centigrade, water is completely stable as a liquid, right? As long as the surrounding environment is between 1 and 99 degrees, it's a liquid. When you get to 100 degrees centigrade, it's completely stable as steam, as long as the surrounding temperature is 100 degrees centigrade. You have to have a milieu that supports what you have done with the frequencies. The frequencies create instantaneous changes that change the state of the tissue. And those changes can be permanent. There are some patients where you work on them 2 times and they're better because they've already done the work. They're already healthy. All you had to do was change the state of the tissue. That woman had her uterus stay healthy and her pelvic floor muscles stay healthy because she'd already done the emotional work around the birth trauma. She'd already done that. All we had to do was fix the tissue. So the changes can be permanent when the patient's metabolism, general health, attitude, physical mechanics, nutritional state support the change in state. I added these slides yesterday because of the questions I had after the lecture yesterday. So we have frequencies for different parts of the brain. This was done by Alicia Thomas. She's a PhD in education. She's a speech therapist in Florida. And she treated patients with concussion. And this was in treatment 1, treatment 2, treatment 3. This patient had been in a coma for 3 weeks, 2 years previously, and this was his EEG. And this is the frequency, this is the area of the brain for the prefrontal cortex. So everything improved except for that, and we have a frequency for the prefrontal cortex. So this third treatment actually worked to bring the prefrontal cortex back down to normal function. And she combined it with brain training exercises. So when you use the frequencies together with whatever else you do as part of your therapy and as part of your professional skill, it supports what you do. It gives you immediate response. And then the supportive therapies you do for the patient makes it permanent. So do many of you do what you would think of as functional medicine? Yeah. So the challenge with integrative medicine, functional medicine, is it takes too long and it costs too much. Irritable bowel, Crohn's disease is 12 months. When you add the frequencies to it and when the patient will follow the diet, it's 6 weeks, 12 weeks maybe, but usually 6 when you combine the two. Somebody asked me yesterday about autism. This is the same Alicia Thomas. She treated an autistic child. This was presented at our symposium in 2013. And in general, the higher number, when the number goes higher, it indicates improvement. I don't know about her testing system, but she said, when the numbers are higher, it's better. And this is reflected in the EEG that she did. This is an EEG measurement on that child. So pre-treatment, week 1, this went from 68 to 70, 65 to 73, before FSM, after FSM, and training. He was there for 2 weeks, 3 weeks. At the end of week 2, after FSM, it went from 70 to 79, And at the end of week 3, he went from 79 to 89. So the EEG measurement measured improvement in 3 weeks in an autistic child that was around 7 or 8. It's much beyond anything you would normally expect. So this kind of change in the period of a week from 83 to 88 is... Oh, that's in the book. That's in the course. It's like a language. It's kind of like if I only speak English and I want to go into a restaurant and order a meal, I have to learn German. So the frequencies are, all of our frequencies are between 0, 1, and 1,000 hertz, and they are in combination, each on 2 channels. So she was treating frequencies for the different parts of the brain, the forebrain, the prefrontal cortex, and the medulla, possibly the midbrain. Her protocol is in her presentation in the symposium. So when you take the FSM course, you have access to be able to buy the compendium that has the slides from all of our courses, all of the presentations at the symposium for the last 16 years. There's a lot of them in a lot of different areas. But it's a reasonable question. Frequencies change genes and speed healing. So how do they do that? We went over this yesterday. Your body is a quantum biological system. Living tissues are biochemicals that are held together by electromagnetic bonds, and every bond has a frequency at which it resonates, okay? Every bond has a resonant frequency. So your body is an electromagnetic system that looks solid, but the cells function as a semiconductor network. They convey current, charge, and electrical information. And your information field is in that semiconductor. And we talked yesterday about the singer that sings a note that shatters a lead crystal glass. That trick works because the note is so precise that it makes the lead atoms vibrate in the matrix of the lead crystal. And when they vibrate so much, they can't hold on to each other, they just come apart. That's how the glass breaks. Biologic resonance explains the effects on living tissue. Drugs or nutrients act like keys in a lock to change that cell receptor and change function. The frequencies act to change the receptors like your key-fob with an electromagnetic signal. So we talked yesterday about the 4-hour window and the patient in the auto accident that got treated one time and then immediately within 4 hours of the time of the accident, and then was better the next day, which is completely unheard of. It was not what was expected. I told her she'd be in pain for 4 months. I told her she'd be worse the next day, and the next day she was pain-free. These genes are what turns on in a new injury. And when you change the stimulus that turns these genes on, it turns them off. But how does that work in practice? I don't know. Do you have poisonous spiders here in Germany? Is it too cold? We have a spider in the United States. It's called a brown recluse spider. And this is a little hard to see, but it's very dark. This is 2 days after the bite. The patient was my friend. And he went to the doctor, and the doctor said, yes, that's a brown recluse bite. In 2 weeks, you'll have a wound there, an ulcer there, a lesion there that is normally 0.5 centimeter to 1 centimeter deep. The toxin dissolves the blood vessels. And yeah, they're icky. And so in 4 weeks, we will do a surgery, and we'll clean out the dead tissue. And then another 2 weeks, we'll do another surgery and clean out that dead tissue. And then finally, in 6 to 8 weeks, it will start to heal. And in 4 months, you'll be fine, but there'll be a scar, and you're going to lose some muscle. And so it was kind of like, ugh, not appealing at all. So he came over, and I put the adhesive electrodes, you can see them up here, just above and below the wound, and made the frequencies cross in the pathway. And you can't see it very well, but these are the frequencies for inflammation. This is a toxin that dissolves the blood vessels, and it causes necrosis. So this is the frequency for necrosis, those frequencies for toxins and inflammation in the arteries. in the blood vessels. That's what it dissolves. So what tissue is it? It's the arteries. What's wrong with it? Well, it's inflamed, obviously. It's being dissolved by a toxin, and it's causing necrosis. So you take those out, and then you treat the tissue to remove the trauma, to, what are the other frequencies? Yeah, the basic trauma frequencies and torn and broken. So this is the next day. So it's hard to see on the slide, but this is very dark purple. It wasn't quite black, but it was very dark and purple. The next day, it's lacier and lighter color, except for right here where the bite occurred. And the day after that, it's smaller yet, and we ran basically the same frequencies. The day after that, I don't know if you can see, but right here where it's very dark, and there's that little spot where the bite actually was, there's 2 spots, it looked like a blood clot. So we ran the frequency to dissolve blood clots, and it started bleeding. It turned from dark purple to light, bright red. It's like, wow, that's really cool. And so we ran the frequency to stop the bleeding, 18 and 62. And it turned dark purple again. And then this is why FSM practitioners have so much fun. It's like, let's do it again. So we ran, dissolved the clot, it turned bright red, and then stopped the bleeding, and it stopped. And then we treated for inflammation and toxicity and necrosis again. And there it is the next day. It's smaller yet, right? This is inches. Dissolve the clot, stop the bleeding, treat the basic problem. So this is 1, 2, 3, 4 treatments in 4 days. And then he stopped complaining about it. And about a week later, I said, you know, we should take a picture of that and see how it is. It was completely gone, right? So the frequencies do exactly and only what they're alleged to do. And when you apply them, it doesn't have to be a big, long, complicated thing. It's all better. There's no surgery. It's pretty fun. Post-operative outcomes, there's a surgeon in the room. So this is after C-sections. This is an OBGYN named John Kale. FSM patients after C-section get out of the hospital slightly less than 3 days. And the control patients with the same kind of surgery done by the same surgeon before FSM, no, done by other surgeons before FSM, get out at about 3 1/3 days. Pain at rest and with activity, much less with FSM patients, and more, especially with activity, in patients who haven't been treated. So he's still working on getting this published. We'll try. Diabetic peripheral neuropathies, those of you that see diabetic patients. This patient was scheduled, This patient was scheduled to have this toe amputated, but they were waiting to see if it would get worse. He had necrosis in the 2nd and 3rd digits, sensation lost in 7 out of 10 areas in his foot, and they were all healed in 6 weeks, in between 6 and 11 treatments. So this is what happened in, geez Louise. This is what happened in 4 weeks. He kept his toes, the sensation came back. Now he's a diabetic, and he's having difficulty staying on a diet, so he has to be treated every week. It won't hold. You have to have a stable state. If you get a diabetic, then get the blood sugar under control with diet, medication, exercise. Then you treat them, and maybe they need treating once every month or 2. There has to be a stable state. New injury. We talked about healing new injuries, but when is a new injury not a new injury? Sometimes the patient comes in and they have terrible pain in the rib, or and the injury seems too trivial to have caused that kind of terrible pain. It is shingles masquerading as a new injury. So we have a case report on shingles in an 85-year-old man in the ophthalmic branch of 5. And it was a single case report. It was publishable by the Pain Journal because the course of the illness in shingles in the ophthalmic branch of 5 in an 85-year-old man is so well known. If you know this condition, you know that it is what he will die with, and it is what he will die of. Shingles in the ophthalmic branch of 5 in an 85-year-old man turns into post-herpetic neuralgia something above 90% of the time, and he will not get better. He was pain-free in 30 minutes, roughly. I treated him for 4 hours, had no return of pain, and the lesions started drying up the next day, and they were completely gone in 2 to 3 days. This is typical of shingles. There is one frequency that's the only thing it's good for. So biologic resonance is the only thing that explains the effects on living tissue. You change the membrane protein configuration and electromagnetic function, or cell function, and cell signaling electromagnetically. It acts as if it changes cell signaling. It acts as if it dissolves the scar tissue cross-links that hold the scar tissue together. And it acts as if it simply disassembles the virus capsid in the herpes virus. It's a fairly simple virus, it's relatively small, and it makes some sense that it's possible that that frequency is actually dissolving or disassembling the virus capsid. I don't think it works the same way in infection, and I don't think it works the same way in parasites. Those organisms are too complicated to be affected lethally by a simple frequency combination. So the resonance effect, a lot of people have purchased the book. I'm very happy. It's how FSM started, what drives me, what our mission is, how it works, how the case reports came to be, and it includes the protocols for many visceral conditions. Asthma, irritable bowel, Crohn's disease, liver inflammation, and diabetic neuropathies. I am of the opinion that the only way to keep something is to give it away. This technique, this technology is not useful if I'm the only one that can do it. So the fact that it's reproducible and teachable, the important thing is that you can learn how to do it, and that patients everywhere can achieve relief. So learn how to use it. This is the textbook in German, which I'm very grateful that Time Waver did the translation. It's very exciting to have it available to people that speak German. There's a 4-day FSM seminar, so that's where you learn the language. I'll give you her protocols. And there's one in Nuremberg starting next weekend on the 1st of December through the 4th. I'll be in London next year, and I have a suspicion I might be back in Germany in 2019. There's some nodding going on here. There's fair warning though. The frequency-specific microcurrent ends up changing your life and a lot of patients' lives. Really is forever. Once you see what is behind what you think you see, and once you have a tool that allows you to change it very quickly, you don't ever get to go back, right? You can't go back to thinking that didn't work. You all have the advantage of already being in that mindset because of what you do with Time Waver all the time with frequencies. Now I have apparently 32 minutes left. I have a case report. They asked me to maybe do a case report. Say again?
Any experience with a stroke?
Stroke. Yes and no. Thalamic pain from a stroke. So thalamic pain, yes, that is treatable. We haven't found anybody yet it doesn't work on. So we are maybe into double digits. We have 20, 30 patients. So thalamic pain, the body pain that comes from a stroke, yes, easy. It does not last. So one of the restrictions is I can't put tissue back that's not there, right? You can improve the function of the tissue around it, and you can change the function of the tissue. I can get rid of thalamic pain. First time you treat it lasts any place from 2 to 12 hours. The second time it lasts 6 to 18 hours. Each time you treat, you last a little bit longer. I've never had it become permanent. So it always comes back, but it always comes back less. So you start at a 9, next time it's an 8, next time it's a 6. and it's gone for longer and longer each time. That's pain from thalamic, periventricular strokes. Paralysis from stroke is different. Spasticity, we have pretty good luck with. Motor function is harder. Spinal cord injuries, incomplete spinal cord injuries, and what do you call it? Brown-Séquard, transverse myelitis, spinal cord injuries. Sensory and pain is easy. Motor is more difficult for whatever reason. We just have more trouble with the motor pathways. Cognitive function with a stroke improves. Alicia Thomas has some interesting data in aphasia. So she does speech training in combination for post-stroke patients with microcurrent for the forebrain and the hindbrain, and then the concussion protocol for the medulla. She does speech training in combination with FSM and the aphasia measurements. Her data is really impressive. So yes and no. It's not a magic wand. I wish it was. I liked Shyam's slide with the magic wand. I wish. But we can usually help. Any other questions? Say again? Okay. So, multiple sclerosis. Can't put tissue back that's not there. Slow the progression, that's easy. Multiple sclerosis is an autoimmune disease, and it's inflammatory. You saw yesterday we can reduce all of the inflammatory cytokines. So from where it is, when you start treating it, you can reduce inflammation so you can slow progression. You can take off the scar tissue and make it temporarily worse overnight, because I can't put the myelin back. I can take the scar tissue off, and the scar tissue is there and sort of helps the conductivity a little bit, but I can't get it back on in time to get them to recover. So slowing progression is easy. Multiple sclerosis patients need to be on high-dose vitamin D until their vitamin D levels are 80 or 100. They need to be off of gluten, off of all inflammatory foods, taking essential fatty acids and coconut oil to slow the progression, and you need to treat their gut. So multiple sclerosis is not, oh, I'll just fix the nervous system. It is slow progression and correct what's causing the immune system to decide that your myelin belongs to somebody else. Yeah? Does that make sense? Yeah. Okay. So this case is a few slides. It's complicated, so I'm going to skip over the frequencies to some extent, but she was 38 years old. She had a 22-year history of abdominal pain that went back to childhood. When she came into my office, she was accompanied by her husband and 3 children. She was in a wheelchair. They would return from vacation and just happened to stop in Portland on a day when I was in practice and had space to see her. So she could not get herself from the wheelchair. She couldn't do her own transfer. Too much abdominal pain and muscle weakness. Aged 6 to 10, she had frequent stomach upsets. She remembered at age 10 vomiting every day before school. At age 16, in 1995, she had abdominal pain and a fever. They told her she had a virus. That was in March. In September, the pain came back and was still there. They told her to change her diet. They gave her antacids, medication. In point of fact, she had a ruptured appendix in September of 1995, which they missed. They found it when they went in to do surgery in February of 1997. So 2 years to a year and a half, she had abdominal pain and fluid in the abdominal cavity. So in March of 97, they did exploratory surgery and found the remains of this ruptured appendix behind her liver. In March, they had to do surgery again. She had an 8-centimeter free-floating abscess in her abdomen. She was to drain the fluid, remove the abscess. She was on IV antibiotics for 8 days. She had another surgery in June of that year to drain additional fluid. And then October, so she had what, 4 surgeries, 3 surgeries in a year. October of '97, she had intense abdominal pain and found that she was unable to walk and unable to move her limbs. So 2 months later, they found an Indian medicine man in the southwest of the United States, gave her some herbs, and that fixed her problem. So 1 year later, she started having flashbacks to childhood sexual abuse. They recommended therapy. She got a therapist. She got a lot better. She got married. 1998, she had a ruptured ovarian cyst that created a lot of abdominal pain. 2000, she had her first child. 2001 and 2002, she had miscarriages. 2003. So this is a pretty scary history, right? And it actually gets worse. 2003, she moved into a new house. They painted it, carpeted it, and within 7 days, she has intense body pain. Digestion is terrible. She lost mobility in her legs, and she was very weak. 2004, she delivered her second child, being in bed. She went to the Mayo Clinic. They diagnosed her with chronic fatigue, fibromyalgia, a psychological conversion reaction, which is what they call it when they can't figure out what's wrong. So it's not just the US that does this, right? Oh, it's all in your head. Lupus, Crohn's disease. She went to see a therapist again. She's very determined. I'll do whatever it takes. She saw a chiropractor who helped her with adjusting her back and her neck and working on her abdomen. In 2005, she's walking and driving and out of the wheelchair. 2006, she's pregnant again. Once again, as the baby grows, she has these adhesions in her abdomen, unable to walk. She's on bed rest for 6 months. She had a C-section and a tubal ligation, but she's still in pain and unable to walk or move. This third child has never seen her mother out of a wheelchair, right? I think. Maybe there's another one. Anyway, so then she turns out 1 year later, she's fine. So this comes and goes, which makes it very confusing. And when she's good, she wants to do things. She's not laying in bed because she wants to. They moved to Arizona. She was stable and mobile. In 2009, she got daily migraines. Psych evaluation said, no, there's no conversion. But these migraines that she had are from elevated, they measured her cerebral spinal fluid pressure, and it was elevated. Right? So your cerebral spinal fluid is created inside the middle of your brain, and it circulates, and then it has to drain out. So anytime the cerebral spinal fluid pressure is elevated, it's because the drain is plugged. Keep that in mind because it'll become relevant when we decide what to treat on her. She had low thyroid, so she's on thyroid replacement. She had more counseling, 2011. 2012, they moved into a new house that had mold and water damage. It was repaired, but she had a severe attack of pain and loss of mobility again, so she's back in a wheelchair in 2012. Then the mobility improved, her pain went down to a 5, and mobility improved, and from 2014 and 2017, when she saw me in August of this year, pain and immobility returned, wheelchair, bedbound, steroids help, so it's something is inflammatory. She had severe abdominal pain. She was hyperalgesic. You couldn't touch her skin. Her children could not hug her. Her husband could not hug her. Her legs were painful to touch, and she had red dots or spots on her arms and legs. So in 2015, they went to Tijuana and had chelation and antibiotics and an allergy elimination diet. And by November of 2015, she was good again. She could move, her pain was down. 2016, July, she was doing something and she felt an abdominal adhesion tear, and that increased her pain. 2017, she ripped an adhesion again, intense pain that radiated from her abdomen and went to the full body, okay? So she was in a wheelchair again. So when you added up all the times that she was in wheelchairs, it was 8.5 out of the preceding 10 years. So when I saw her, she was back in a wheelchair again. Arm and leg movement. If she moved her arms and legs, she got weak and faint, and her body pain went crazy. So the exam was pretty minimal because you couldn't touch her. Pain was an 8 out of 10. She's very stoic. You know, some people say, oh yeah, I'm a 9, and they're smiling and happy. And she's like sitting there focusing, but her pain was realistically an 8. She was not dramatic. She had no exaggerated pain behavior. Her salivary cortisol from the data that she had, so her adrenals were depleted. I didn't do a sensory exam because you couldn't touch her. Light touch on all extremity surfaces. So I did this to measure sensation, and she would flinch and break into a sweat. Abdomen, light touch on her abdomen was 9 out of 10 pain. And she said, I said, why are you always in bed? And she said, if I sit up, I bloat. I was like, well, okay. So they got her out of the wheelchair and put her in a chair. And I'm sitting there during this hour-long history and watching her abdomen. And her abdomen increased in circumference and girth by 6 centimeters. Yeah, 4 to 6, yeah, just like when you could just see it getting bigger. It's like, okay. So any abdomen, anything that makes gas, so the bacteria in your intestines, you have 8 pounds of bacteria in your intestines, they ferment and they digest your food, but they ferment things. So the bacteria in her intestines are what's making her get big, right? This is it's carbon dioxide. It's being made by something that's inside of her, and that's bacteria. She had minimal trunk movement, arms and legs were movable, but movement increased pain. So this is the treatment. And I wasn't sure I wanted to put this in, but it's like, it shows you what's possible when you have a tool that allows you to address what can't be addressed otherwise. So I had to use 3 machines on her. The hyperalgesia, do you remember the fibromyalgia cases from yesterday where you ran inflammation in the spinal cord and it reduced all the pain and the inflammation and substance P, right? Those patients have hyperalgesia. So in order to be able to touch her, I had to run 40 hertz, reduce inflammation, and tend the spinal cord from her neck to her feet. So I did that with 1 machine. So there's 1 machine, my device, 40 and 10, and it ran 40 minutes until her pain was down from an 8 to a 3. Now there's frequencies for mold, and if the mold, so 23 and 95, frequencies for mold, and if her pain increased and her illness increased when she moved into a moldy house, there's a pretty good chance that the mold toxins have affected her spinal cord and parts of her brain. So I ran that frequency, and then scarring in the spinal cord and the dura with some slight movement, because scarring in the dura will cause an increase in CSF, or cerebral spinal fluid pressure. Unless you had a tool that you knew would dissolve scar tissue in the dura, it would never occur to you that this was a way to change cerebral spinal fluid pressure, right? So it's the presence of the tool that made this treatment possible. And a lot of times, 20 years ago, not knowing what to use. So then once her pain was down to a 2, they get the strangest look on their face. They just look confused. And I had a patient once that was able to put it into words, and she said, I feel as if I should be in pain, but I'm not, right? And that is mediated by the thalamus, by the pain center in the brain. So to make that confusion go away, to make that it feels odd to be out of pain, I ran quiet the activity of the midbrain or the thalamus, and in 20 minutes it was normal to be out of pain. torn and broken in the ligaments in her suboccipitals. She had some lax ligaments up there. So she actually did not have migraines. It was a bad diagnosis. She had scarring in the nerves, scarring in the dura. She hasn't had a migraine since this treatment. The second machine was running from her back to her abdomen. And the concussion protocol is what we talk about is to normalize central nervous system stress and to treat the medulla. It's what Van Gelder used as a foundation for everything we do in the nervous system. And then there's a protocol for the small intestine that contains this frequency for fermentative toxin. And so I navigated on that and ran the frequency to remove fermentative toxin. It ran for 45 minutes or an hour, reduced the bloating, reduced the pain. And then the next thing I did once that was gone was treated for the infection. These frequencies are for pus and pus encapsulated. And she had tremendous pain in the right upper quadrant. Remember when her appendix ruptured, they found the fragments up behind her liver? She ran pus and pus encapsulated from the original abscess. It had been there 20 years. So she was never really ever out of pain, even though she was able to get up and move. So that was this one. And then the third machine, that's when we started to take apart the adhesions in her abdomen. 13 and 77, remember the rats? Right? This case is complicated, but I'm hoping you're following. So 13 and 77 is what we learned from the rats. How do you take apart adhesions in somebody that has had adhesions in their abdomen for 20 years? And then that removed the adhesions between the gut and the side walls, and then adhesions in the bladder, the ovary, the tube, the colon, the transverse colon, the liver, the small bowel, the descending colon, and the sigmoid. But here was the key. That is the frequency for the vagus nerve. That is the reason she couldn't stand up. Her vagus nerve, right, comes down from here and attaches to all of your intestines. If the vagus nerve is adhered, is scarred down to your organs, when you're laying down, it's at ease. When you stand up, the organs pull on the vagus nerve, and what does that do to your heart rate and your consciousness? You have to lay down. So these adhesions would come and go. So when we dissolved the adhesions between the organs and the vagus, it got better, and then the sensory nerves. And as the abdomen softened, it was possible then to palpate her psoas. It was incredibly tender. And her quadratus lumborum and her psoas were rock hard and very tight. And why would the cerebellum tighten the quadratus lumborum and the psoas? What organ, what visceral structure lays across those muscles? The kidney, the ureter, and the fat pad behind the kidney. With all that inflammation, those critical organs were scarred down. And is the cerebellum going to let a muscle move, the psoas and the QLs? Is the cerebellum going to let you elongate those muscles? No, it's not open to negotiation. So they stay tight. When you take away the scarring in the ureter, the scarring in the kidney, the sclerosis in the fat pad that's behind the kidney, all of her psoas and her QLs just went pudding, we decided. They just soften. Now, up until now, I did not run the frequency to remove inflammation or bruising from her abdomen. Do you remember why from yesterday? Right? If you reduce inflammation, what happens to infection? If you take away inflammation, the infection gets worse. In my seminars, I throw chocolate when people get the correct answers. So that man would have a dark chocolate with almonds is what we throw. And so then I ran the frequency to reduce inflammation in her abdomen, and it was like her whole system quieted down. And then because of all the bleeding, the ruptured ovarian cysts, there's bruising. So from that frequency 284, that dissolves blood clots. She had endometriosis and chronic inflammation and clots, and that dissolved that. At the end of it, her pain was a 2 out of 3. So this is just a little picture that shows you how that all works together. There's the kidney, there's the ureter, there's the bladder, and you treat adhesions all along the way. And just this, I'm a manual therapist, so I use my hands on people. And there's the psoas, trigger points, cause that, and that's how you fix them, not by treating the muscle. She wouldn't tolerate having the muscle treated, but if you can dissolve the adhesions between the kidney, the ureter, and the fat pad, you can get the muscle to relax. So, pain was a 2 at the end. We had to teach her to walk again. She walked to the car. 12 days later, her pain was still a 4. I sent her a urine test kit for mold. It came back positive for black mold, which is neurotoxic, which explained a lot of her symptoms. Every time she moved into a moldy house, she got re-exposed to mold. It activated the mold colonization in the sinuses and the intestines, and the mold poisons the vagus nerve and poisons parts of the brain and immune system. So July 10th, she came in just beaming and said that her pain was only a 7. Now, she came in by herself. She flew from Idaho to Portland, which is an hour and a half flight, by herself. No wheelchair, no husband, no caregiver, just her. Pain was only a 7. Her abdominal pain was a 5. I ran 40 and 10, inflammation in the spinal cord for 40 minutes, and her pain was a 0. We treated the abdomen again, treated the quadratus lumborum again for those scar tissue. And then that ruptured ovarian cyst was pesky, so I treated inflammation in the ovary. The neck and the headache, treated to quiet the accessory nerve, to quiet down the SCM and the upper trapezius. So there are many things you can do. This patient came from out of town, and she was the only patient I saw that day, right? Urine mold test was positive, so now we do things with her medical physician for cholestyramine and chlorella. Do I have 8 minutes, or I don't have 8 minutes. They set the timer. I'm watching the timer. They set the timer. They said I have 8 minutes. You're looking, no? Okay, let me finish then.
Okay.
So, what else? So they'll treat for the mold. She left with a custom care that she'll treat herself to keep her pain down, and then her endocrine system will recover. So the take-home message is think. This is a very scary, difficult patient. Do what's sensible. In our world, do what's easy, and be comprehensive. If she lived in Portland, I would not have done it all in 2 visits. I would have done it over weeks or months. But that's what it made possible. This is at the end of her July visit, right? So the take-home message is the frequencies make it possible, and they change your life, and you will change many lives. And it changes everything forever. There we go. I did not know I went over time. I thought they set the timer, so I was watching.
Yeah, no, you were absolutely right.
Oh, okay, good.
So you still had 8 minutes.
Oh, good.
It was my mistake.
Oh, good.
But it's anyway good. So thank you so much. I think this is really a beginning of a new area also for TimeWeaver. You will help us to get closer to the body of the patients. Mm-hmm. Because people who work with the information field, sometimes they are in the information field, yeah. And I think it's this holistic approach from the information field through the frequencies, through the touch, to the body is something which we really need to see the person as a whole.
Well, and the information field work you do is very important, because had she not already done the emotional work and the psychological work to prepare herself for recovery, I don't know that we would have had such quick, profound, easy results. She'd been working on the emotional for 15 years, for 10 years. She'd already done that work. So when you have the ability to work behind on the information field, then fixing the body is easier when you combine it with the other things you do.
And it's anyways through the information field, because it's through the information field resonance that you came to us. So it's all arranged.
Absolutely.
So in a perfect way.
I'm very
And
grateful. Oh,
this is for Carolyn? Yes.
oh,
So just a small thank you.
oh, beautiful. Oh,
So we hope
Thank
to
you.
have you again for summer work.
yes.
Oh no, it's your graduation of your daughter.
Yeah. Next year I can't
Okay,
come.
but for the next Time of Our World, we will arrange in such a way that we make sure
Yeah.
you will have time.
I can't come next year because my daughter's graduating college. I can't miss that.
I think in US, this is one of the most important days in your life, isn't it?
Yeah, for my daughter. It's
Wonderful.
fun. Thank you so
Again,
much.
thank you
It's
so much.
grateful to be here. Yeah.
Thank you.